I know you've been thinking a lot about this PCR test requirement, still required within 72 hours of coming back into Canada. From a public health standpoint, does that requirement still make sense? Can you make the argument for keeping it?
I think there's a role for testing when you have people coming back from overseas, but when you're talking about day trippers, when you're talking about people who have gone to the U.S., driven across either for 1 day or at most 2 days, testing people in the U.S. doesn't actually really make sense because the test is not reflecting any infection that they may have had while they were there. The situation also has changed a little bit. The situation in the U.S. is a bit better than it was previously. The vaccine rates are higher. We have less circulating COVID. So there's, a few reasons why the tests have certainly become less imperative. And the way the guidelines are written now, that you have to have a test within 72 hours, a lot of people are either getting tested before they leave Canada, which doesn't actually make sense, or they're getting tested in the U.S. when they go on a day trip. But because it takes you 2 or 3 days to test positive, let's say if you were infected today, you would only test positive 2 or 3 days later. If you're going for a short trip like this, the test isn't actually doing anything. The point of testing people when they cross the border is to try to catch people who are sick, to have them self-isolate, and to prevent the introduction of new variants into this country. So its original point, which was, I think, fairly valid several months ago, is less valid now when you're talking about people who are driving across the border for short trips rather than flying to the U.S. for extended vacations where they could potentially become infected.
Okay, so what we learned on Friday from the Public Health Agency briefing is they are actively thinking about this PCR test requirement. And certainly, as you make the point on those short day trips, that's an aspect where it may not be as logical given when somebody actually shows signs of infection. Is it reasonable at this point to move to a rapid antigen test, which would be right at the moment and might pick up, even though maybe these are not as accurate as PCR, but would it be done maybe even right at the point of crossing or closer to crossing and maybe more reflective?
So you could do it. The problem with the rapid antigen test is that, if you're testing somebody who took a day trip to the U.S., whether you use a PCR test or an antigen test, you still have the fundamental same problem. It takes you time to test positive. If you're infected on day 0, you may only test positive on day 2 or 3. So the type of test that you use isn't going to help you with regard to the timing issue. I think the rapid antigen test may have some value. It's certainly cheaper, it's certainly faster. And when you're talking about testing people, let's say at the airport who are flying in, I think there is some value there. And, listen, rapid antigen tests are easy. The point of using rapid tests is that you can test a lot of people on a broad scale and get the results back quickly. But timing-wise, for people who are driving across the border for 24 hours, I'm not sure it really has much benefit. It would be much better for them to get tested after their return to Canada after some time, just to make sure they didn't get infected when they go to the U.S. Although that depends a little bit, too, on what you're actually doing there. If you're crossing the border to go shopping at a shopping mall, it's not really any higher risk than going to a shopping mall here in Canada, depending on, what the situation is in the city in the U.S. where you're going to. So there is certainly a value. There is some little bit of protection that you get by testing people more broadly, but is that justifiable given the cost and inconvenience? I think that's where the debate is really happening right now.
And this must be what they're considering, because the number that we got again from Dr. New on Friday was 0.18% of vaccinated travelers coming into Canada are still testing positive. If you open up the flow and more travelers are coming into Canada, ostensibly, that number would go up, and you could have quite a few people coming into Canada with a proportionate increase in the number of people who are positive. But again, is that enough to offset the concerns? Have you landed on a solution yet? Because it sounds like public health officials are really wrestling with this one.
Yeah, no, I think they will. I think what's ultimately going to happen is that they'll probably make a distinction between people who are flying in from overseas and people who are driving across the U.S. border, because the situation is not quite the same. And a lot of that is going to depend on what happens in the U.S. If things in the U.S. stay stable, especially for the northern U.S. states, which are the ones where people are usually visiting. So when you're talking about Maine and places like that, Vermont, where the situation is pretty good, all things considered, that have high vaccination rates, I think you might see a distinction between that.
Okay.
And yeah, so I think we'll see. And also the policy may evolve. And I think we have to realize that sometimes there's always going to be situations where a policy may not directly reflect your specific situation, but policies have to be broad and have to be all encompassing as possible. So I think there's a value in testing people who come from overseas. And does that mean that you get inconvenienced a little bit, even if you went to a low risk area? Maybe, but it's going to be very hard to have a policy that's too granular and too specific to you. So the big distinction may be driving versus flying.